Well, good morning. We'll go ahead and get started with an update on the numbers. Today, we had 107 new positive cases for a total of 3,748 positive cases. We had no new counties, so we have a total of 84 counties. 522 negative cases today for a total of 24,496 negative tests. The State Hygienic Lab has 6,248 tests available. We have had 1,428 Iowans recovered for a recovery rate of 38%, and we have had an additional 7 deaths for a total of 90 deaths in the state of Iowa, and 51% of those deaths are among residents of long-term care facilities. Across the RMCC regions yesterday, there were 272 COVID-19 patients hospitalized. 70 were admitted in the last 24 hours. 92 patients are being treated in ICUs, and 57 are on ventilators. Also, in hospitals across the state, there are 4,082 inpatient beds, 547 ICU beds, and 689 ventilators that are available for patient care. Today, the Department of Public Health has also confirmed another long-term care facility outbreak at St. Francis Manor in Poweshiek County, and this does bring the total number of long-term care facility outbreaks to 11. Yesterday's press conference, I announced the launch of Test Iowa, and it's a statewide initiative to assess the health of Iowans, increase testing for COVID-19, and really track the virus activity so that we can mitigate and manage it and start getting life back to normal. Iowa's response to this opportunity has been incredible. In the first 24 hours alone, more than 80,000 Iowans completed the online assessment, and more than 250 scheduled an appointment. We had 631 social media mentions of the hashtag Test Iowa Challenge, with a reach of over 18.8 million. Iowans are engaged and they're excited, so we want to keep the momentum going. And you can help by going to testiowa.com and taking the assessment. It's really the first step to understanding more about the virus activity in Iowa. Again, what we can do to mitigate and start to manage it so that we can open businesses back up, get life back to normal, but do it in a very safe and responsible manner. Our first drive-through testing site opens on Saturday at the Iowa Event Center, the north parking lot in downtown Des Moines. And we're identifying locations now for additional sites in other communities across the state. We want to reach as many Iowans as possible, and at this time, Test Iowa is being prioritized for those who currently have symptoms, have interacted with someone who have already tested positive, or have recently visited places where COVID-19 is more widespread. So if you work in healthcare, law enforcement, manufacturing, or other essential services, please complete the assessment. It is critical for all Iowans that you stay healthy and well, and this again will help us kind of understand the scope and spread of the virus and help see if our workforce have symptoms. We can get them the test and get them back online. So we would encourage our first responders and healthcare workers and essential workers take the test. If you don't qualify for testing after completing the assessment the first time, that doesn't mean that you won't qualify later. So if you develop mild symptoms, or you begin feeling ill, or if you become aware that someone that you've been in contact with has had COVID-19, then take the assessment again. So this is really a way to manage your health care through the Assessment and Test Iowa app. Your health can change day to day, and there's no limit to how many times you can complete the assessment. But the assessment, it's not a replacement for your health care provider, so just remember that if you are sick and you need medical attention, you need to call your doctor. So be sure and follow through what we've been telling you to do, and this is just another tool to help us mitigate and manage the spread. As you are aware, the Department of Public Health is closely monitoring our long-term care facilities and communities with increasing virus activity or confirmed outbreaks. And they really have, from the very beginning, have been taking proactive measures to protect staff as well as residents. So today, the Department of Public Health is sending a long-term care facility strike team to Tama County, where increased virus activity is in the area, and it could increase the risk of exposure to residents in surrounding communities. So by proactively conducting surveillance testing of long-term care facility employees in the area, we do have the opportunity again to isolate and identify positive cases early and potentially prevent exposing additional vulnerable residents. The team of nurses, with the support of the Iowa National Guard, will conduct diagnostic and serologic testing for all staff members of the long-term care facilities in the area. I've asked Sarah Reister from the Department of Public Health to provide more information about this important effort. Sarah?
Thank you, Governor Reynolds, and thank you to Director Garcia and her staff at DHS, as well as to Adjunct General Correll and the National Guard for all of your support in assisting the Department of Public Health with this effort. There are still a lot of things that we don't know about this virus, but one thing we do know is that it spreads quickly and efficiently in settings where people work and live in close proximity to each other. As we mentioned last week, we have been developing plans for long-term care facility testing strike teams. The goal of these teams is to provide support for long-term care facilities and their staff, and to prevent the spread of the virus in order to protect the people who live and work in these facilities. As we've seen in Iowa and other states, despite best efforts to prevent the spread of the virus after it's detected, devastating consequences can occur if it's detected too late. We want to do everything we can to prevent those tragedies from happening. Our department and local public health agencies have been working with the long-term care facilities throughout our state for months now to prevent the virus from entering these facilities where some of our most vulnerable Iowans live. We are taking the next step today by sending a long-term care facility testing strike team to Tama County, where we have seen positive COVID-19 case counts increasing. The goal of this long-term care facility strike team is to offer COVID-19 testing to employees of long-term care facilities in Tama County, some of the many heroes on our front lines. All employees of the long-term care facilities in Tama County have been invited to participate. The testing site has been carefully planned to prevent transmission of the virus during testing. It is occurring at an off-site location, and employees will be offered both diagnostic and serology testing, as Governor Reynolds mentioned. Diagnostic testing will let employees know whether they currently have the virus, and it will allow facilities to take proactive measures to prevent the spread of the virus if they do have staff who are currently positive. Serology testing is intended to let employees know whether they have already had the virus. Again, there are a lot of things that we don't know about this virus, one of which is whether a previous infection actually provides immunity from reinfection. And the other is, if we do get immunity once we have the virus, how long does the immunity last? The serology testing will help us learn more about how many people have already been infected and either were asymptomatic and did not know they had contracted the virus, or who experienced mild illness and were able to recover. The long-term care testing strike team operation in Tama County will be happening today and tomorrow. The National Guard will be providing logistical support for the testing event, and the Department of Human Services nurses will be conducting the testing. The National Guard will also be assisting in transporting supplies to the State Hygienic Laboratory. Supplies and samples, sorry. The operation will occur today from 1 p.m. till 8 p.m. and tomorrow from 7 a.m. until 5 p.m. Again, all employees will be given the option of diagnostic and/or serology testing. Those coming for a test will be asked to wear a mask or a face covering, and all personnel staffing in the event will be provided with appropriate personal protective equipment, or PPE. At this time, we anticipate testing more than 200 staff that work in Tama County's long-term care facilities. These types of testing events are an important step in a continually evolving response to this global pandemic. We want Iowans to understand that through events like this one in Tama County, and by increasing resources at the State Hygienic Lab and through efforts such as Test Iowa, launched yesterday, we're continuously working to provide more testing capacity for Iowans. Testing is just one component of the COVID-19 response. And in closing, I want to take another opportunity to thank Iowans for doing their part. Please continue to stay up to date with the latest public health news, stay home as much as possible, and leave only for essential errands. And if you do need to leave your home, please practice responsible social distancing. Thank you. Now I'll turn it back to you, Governor.
Thank you, Sarah. And I do want to thank everyone that's been involved in making this possible. It's so important that we take every precaution that we can to protect our long-term care facilities. I also want to thank Homeland Security, Emergency and Management. Their EMAs are on the front line and a big part of this testing as well, so they're helping coordinate a lot of the interaction that's taking place at these sites and will be very, very instrumental moving forward too. So I inadvertently left them out, and I didn't mean to, because they've been very integral in being a part of this. I also want to clarify for the public that the testing that's happening in Tama County is specifically for the long-term care facility employees in that area. So it's not a Test Iowa drive-through site, and so it's not open for the public. But this is, as we collect the information, that allows us to really see where we need to do the Test Iowa drive-through sites, like the one that we'll be conducting at the event center on this weekend. So this is separate from that. We identified that this is an area that we should really, kind of with the increased number in positive cases, reach out and provide this type of testing. They're doing it through somewhat of an appointment basis, so we've been very systematic on how we're having the individuals, the staff and their family come through and do the testing. So again, if you're interested in being tested for COVID-19, go to testiowa.com for more information and complete the assessment. And as you've seen in recent days, the more tests we conduct, the more positive cases that we're going to identify. It's just the way that it's going to be, especially as we're doing some of these large testing events at some of the processing plants. So as our numbers have grown over the last week, so has the concern among Iowans. But I want to challenge that a little bit today. We've known for several weeks that substantial spread was occurring across the state, and we've taken significant mitigation measures to slow it because we knew it wasn't possible to stop it. So COVID-19, it is a part of our life, and we must learn how to live with it until a vaccine is available. The more we know through increased testing and contact tracing, the better that we can really target our response and mitigation efforts through comprehensive ways to manage the spread of the virus with speed and accuracy. And really, again, I want to just reiterate, begin to get life back to normal. So we're getting closer every day, but we aren't quite there yet. So we expect our numbers, and you're going to see that continue to increase over the next several days, especially as Test Iowa sites open and more Iowans are tested. But that really is a part of the narrative that we need to know, especially as we start talking about drilling down extra, working with areas that are potentially hot spots, and as we look to open up other areas of the state. So as Sarah said, we need to stay focused, continue to do your part, and together we will get through this, and we're going to be able to start opening Iowa back up. So with that, we'll go ahead and take questions.
Governor, a couple testing questions. Yesterday, the Polk County Emergency Management Group met, and they're saying that the Tyson plant in Perry is not doing surveillance testing. Do you have any information on that? Will you ask them to do that? Are they doing that?
So I think I don't know if they haven't done surveillance testing at the site. I think they've made their employees aware of where they can go to get tested. We'll be working with the Tyson plant in Waterloo, and we will be testing all of their employees there. I think they're anticipating starting that on Friday. So we are going to be testing their employees, and this is something that we can make available to different facilities. There's different ways that they can do that. They can go through their local healthcare providers and just make sure that the employees know that that's an option, but we can work with different processing facilities across the state to be a partner in helping them do some surveillance testing on their employees as part of their mitigation efforts and to keep the processing plants up and going.
And we're also getting questions from viewers about, they've done the assessment, they've gotten permission to do a test, but the times are all taken up for this first test on Saturday, the site. the
Yep.
appointment times.
Yep.
They're wondering when then how is that going to work?
So we'll follow up. This is evolving, so this will be our first go at it. So we're going to learn a lot with both of these test sites that we're implementing today and Saturday. Saturday is the first Test Iowa drive-through site. So, but we will be following up with them, and we will be scheduling them a time, and we'll be doing that as sooner rather than later. So we just want to make sure that we can manage the people that are coming through. I think we're at 232, 242 is the numbers that we're at right now. And so, as I've said earlier, I mean, we'll have the capacity to significantly increase that once we start to, get the system, once this becomes operational.
And with the Test Iowa assessment, obviously you need a computer. It also calls for a cell phone and an email address. How are you reaching Iowans who maybe don't have access to one or all of those things?
Yeah, so if you don't have internet access right now, you can either go to 211 or you can call our office at 515-281-5211. Or always remember that if you're having symptoms and you're not feeling well, call your doctor, or and walk through with them the assessment, and then they can help facilitate testing as well. So all of the above are areas that they can outreach and hopefully complete not only an assessment, but if they are symptomatic, then have the opportunity to do the testing. And we'll continue to, that will continue to evolve, but right now those are 3 ways that they can complete that.
And the Test Iowa assessment, like in normal times, it feels invasive, not to put too fine of a point on it. Like, how do you reach Iowans who maybe don't trust getting that level of information to the government?
Well, we talked a lot yesterday about the security, and we own the data. It's secured by Qualtrics that has, have the, what do I want to say? The security at the highest standards. That's what I'm trying to say. ISO 27000 certification. It's protected by HIPAA. We own the data. Public Health are the ones that will be reviewing it. But we've put all kinds of protective measures in place to ensure Iowans that the information that they're providing is protected and will not be shared. And really, and as they said yesterday on the call, there's really a processing company. So we're taking that data, we're aggregating it, and then utilizing it to set up test sites, to be able to make sure that we have sufficient PPE, to identify early on if we're starting to see a cluster or a significant hotspot, so we can get in there and see what it's attributed to. So it really allows us to more comprehensively, I think, address and get an overview of the state based on Iowans going in and taking the assessments.
Is there any randomization of the information to make sure that it can't be tied back to individuals?
Well,
even
that's
on
what I was going to say, and I stopped short of that. So they have it's a QRC code, and that's really the identifier going forward. So when they come in, it's not their name, it's not any of their personal information, it's a code that's assigned to them, and that's actually what's scanned when they come in to do the assessment, to actually take the test.
What about on the data storage side?
That's all within, we own the data, and it's ours. Did you have an additional question? Okay.
And then to the long-term care strike force,
Yeah.
when will we know the results for those tests that are happening today and tomorrow, and will that information be made public, segmented out, like you've been doing for the meat processing facilities?
I assume, but it'll be 24 hours, I think, approximately.
Yeah, so because the samples will be taken today and tomorrow, they'll go into the state hygienic lab, and so how many they can run just kind of depends on how many samples they get in. We heard on the call with Dr. Pintel this morning that their samples really do ramp up on Thursdays and Fridays. So usually it takes 24 to 48 hours for us to get those results, and then we'll certainly talk about the reporting piece of it and provide as much information as we can.
All right, we're going to go to Rod over at the Gazette. Go ahead, Rod.
Yes, thank you, Governor. Do your metrics still indicate Iowa's peak will occur by next week, or have you revised projections? And if so, how will that affect the April 30 deadline for your current emergency orders to expire? And have some regions outside the 8 counties considered hotspots with 70% of the positive cases already moved into the 14-day window recommended under the President's Open Up America phased plan?
So we're going to continue to base our decisions based on data. That's what we've done all along. But with the information that we're gathering and with a lot of the mitigation efforts that we've put in place and Iowans really doing their part in responding, we are right now able to really kind of target where some of the hot spots are and what we're seeing happening with, long-term care facilities and then some of our processing plants. And so we're testing so we understand what the scope is in areas where those are located, but there are a whole lot of other areas of the state that are doing really, really well. And so we'll be able to look at the data from a statewide perspective, from a regional perspective, from a county perspective, right down to a community and a zip code. And so by being able to really look at the data and apply the metrics at that level, we can start to, when we can take a look at starting to open up different areas of the state. And so that's what we're working on. Our team is going to be working on that today. We need, Iowans are ready to get back to work. They want to be working, but we need to do it in a responsible and safe manner, and that will be, at the forefront of the decisions that we're making. But I think about 70% of the positive cases right now are in 8 counties. So we have several counties, and there's like 15 that don't have any cases whatsoever. We have a significant amount that have 20 or fewer, and then when you take into account the number that have recovered in those counties. So we need to continue to watch it, and if Iowans go on and continue to take the assessments, we can continue to kind of manage and monitor that and see if there's some areas where we start to see maybe a little bit of a surge or a little bit of a hot spot, and then again we can get in there and do the contact tracing and start to better understand where that's coming from and why, and hopefully get in front of it.
All right, we're going to go to Channel 13. Go ahead.
Good morning, Governor. We had some questions from some people about the testiowa.com website. One of the series of questions ask about potential allergies a person may have, and on there is included that anti-malaria drug that the president's been pushing, that study yesterday said may actually not be helpful. Do you know why the allergies would be included in that questionnaire?
I don't know if you know the answer to that. That's probably, I know Dr. Padati reviewed some of the questions that was already being utilized, the assessment that was being utilized in Utah, and then we were able to kind of adapt some of the questions to make it fit Iowa. So I know she was involved in that process, but I personally don't know why that was on unless you do, Sarah.
I think I would just add that in terms of the assessment, it would just be collecting information in case that ever would become a treatment. I think just trying to be proactive and gathering information at the outset in case that ever is an approved treatment for COVID-19. That would be the reason for asking that particular question.
And to follow up on that, in the contract itself, it lists the use of hydroxychloroquine and chloroquine as an optional consideration. Is that being actively considered by the state to allow that use?
No, not right now, but I think that's a really good point. But that's how we can use this assessment in so many ways to be proactive as we're working with Iowans and they're managing their own health and talking about, as they take the assessment, that's a great opportunity to be proactive and to be ready because they are running clinical. South Dakota is doing a statewide clinical with it as well as other areas of the state. So once that information comes in, if it is approved, this would allow us to move in that direction. But right now I'm not necessarily looking at that.
Aaron Murphy, go ahead.
Thanks, Governor. Do you have any early data on how many people took the Test Iowa assessment in the first roughly 24 hours, and what share of respondents received a recommendation to get tested?
Yeah, we'll give you more of those metrics tomorrow, but we have had over 80,000 Iowans already that have completed the assessment. We had a huge adoption. We had over 193,000, I think, Iowans that actually went to the site and, took a look at it. Some started the assessment and then pulled out, and we've got metrics on that too. But really, just to put it into perspective, and this is nothing against Utah, but it's just Iowans are responsive. When Utah launched theirs, they had 30 30,000 assessments complete in the first 24 hours. And Iowa, we were, we were close to 80,000, and we're over that now, where Iowans have gone on and completed the assessment. So, I mean, they're interested. They want to be a part of it. They want to get Iowa back open. They want to know what's going on in their communities and in their counties. And this is a way that we actually can help provide them some of that data.
All right, we're going to go to Perry Beeman at the Iowa Capital Dispatch.
Thank you, Governor. Regarding Test Iowa, do you know where your contractors are coming up with that many test kits? And also, how is the state hygienic lab becoming equipped to handle this extra volume?
Well, actually, they provide all of the equipment and the test, and they've done that in the private sector, and we were able, and then they're actually setting up the equipment at the state hygienic lab in Iowa City. So they're, I think, working on that today. We hope to have that done, at least the parameters set up by the end of the day. But that is all provided through the contract with Nomi Health, Qualtrics, and Domo does the front facing of the website. But through Nomi Health, all of that is provided through the equipment, through the contract.
All right, we're going to go to Jared at the Carroll Times.
Hi, Governor. Regarding the lack of cases in western Iowa, does that mean we might not see the same number of infections as eastern Iowa, or does it mean we're just delayed and that delay might complicate the lifting of restrictions on businesses and social gatherings?
Well, hopefully it's well, why don't I let you, Sarah, talk about the numbers?
I was going to say, I mean, I think that, and I think this is about what the governor was just about to say, which is that, we think that the virus has been spreading in our communities now for a couple of months. And so I think that probably what that reflects is that that particular area of the state is doing a good job of staying at home when they can, and social distancing when they do need to go out. And be out and about and leave their house for essential errands. And so I think that could be a reflection of just that Iowans are doing their part and they're staying home and they're taking the governor's recommendations and public health recommendations seriously. So we thank you.
All right, we got time for 2 more questions. Associated Press, go ahead.
Thank you. Governor, your April 16th order that banned social gatherings in northeastern Iowa had a clause that barred local officials from closing businesses that they believe are unsafe for workers. It gave that power to the Iowa Department of Public Health. Why should the state and not local officials be in charge of those decisions? And should you have acted sooner related to the Tyson plant in Waterloo?
Well, first of all along, we've been basing our decisions based on data that's been provided. We have worked extensively with the Iowa Department of Public Health and their epidemiology team in conjunction with the CDC, and each one, the epidemiology team, the Department of Public Health, CDC, have worked in consultation with their counterparts in states all across this country. This is an unprecedented virus. This is evolving on a daily basis. Every day we learn something new. Every day we have more access to testing, to different types of testing, to high throughput testing, to addressing some of the PPE issues, and making sure that we're doing everything that we can to protect the health and safety of Iowans. So we could probably there's always more we could have done, but I think we've been tried to be very proactive. We've tried to reach out to the businesses and to the long-term care facilities and to do everything that we could to not only protect the most vulnerable, but to make sure that we were protecting our healthcare workers, our first responders, those essential workers that are on the front lines. The way that we really put the RMCCs in place and took a regional approach to make sure that we could be prepared in case we did see a surge in cases, so we wouldn't overwhelm and collapse our healthcare systems. We are demonstrating, I believe, on a daily basis, based on what Iowans have done and how they have been responsive, that we are in really good shape when it comes to beds and ICU beds and ventilators. And that's a reflection of Iowans listening and taking, and applying the mitigation efforts that we put in place. and hopefully that has flattened the curve. It has reduced overwhelming our healthcare system. It's bought us time so that we can continue to increase the PPE supply. We're seeing more and more of that come online, and so every day we're making significant advances, I believe, in addressing COVID-19, and to the point where we're going to start talking about how we can open things up in this state based on what we've been able to do and based on what we've put in place. And so I know Iowans are ready for that. We'll do it in a responsible and safe manner, but we are looking at how we can start that process.
Last question, Rachel, Channel 5.
Good morning, Governor. We are curious where the medical personnel and PPE are coming from to staff the pop-up sites.
Is it coming out of the national or our supply? A lot of it would be coming out of the state supply, yeah, for the PPEs to do that. Oh, okay. They are also providing that. Well, I'm learning every day right in front of Iowans. So they are actually providing some of the PPE too. They're doing all the supplies, and then we're asking people to come to wear a mask. So we also have an obligation to be a part of it, but they are providing the supplies as well. So just before I close, really quick, there's one other thing that I'd really like to say a big thank you for, and that is I want to thank Iowa PBS for providing Spanish translation of these press conferences going forward. So they have been an incredible partner, and I just want to thank you for making this information available to even more Iowans. So thank you for being a partner through all of this and all that you're doing to make sure that we can get the information out to Iowans. I appreciate it very much. Thank you.